Hi, and welcome to the Floating Doctors Preventative Healthcare Series, Building a Healthier Future. I'm Dr. Benjamin Lebreau, founder of Floating Doctors, and I'd like to share with you a talk by my father, Dr. George Lebreau, on some increasingly dangerous and extraordinarily common sleep disorders that frequently go all too undiagnosed.
Such an epidemic in this country that is so dangerous. Ever since they invented the internal combustion engine, it's become dangerous. I was looking at photographs of Americans from the 1850s through 70s, which is the first time we have a lot of photographs. I was looking at photographs of senators, representatives, Supreme Court justices, military leaders. To the modern American eye, they look gaunt. The modern American man and woman has so much excess fat that if I get rid of this, I look like that. We are all carrying a great deal of excessive fat, and that is the reason why we have an epidemic of obstructive sleep apnea-hypopnea syndrome.
Tell us something new.
What's obstructive sleep apnea-hypopnea syndrome? Well, it's considered an apnea if you don't move air for more than 10 seconds. It's considered a hypopnea if your airflow becomes less than 50% of normal and you drop the saturation of your hemoglobin with oxygen by at least 4%. The syndrome is a pulmonary problem with a wide array of non-pulmonary consequences. Social, safety, pulmonary, gastrointestinal, immunologic, metabolic and endocrine, neuropsychiatric, and cardiovascular. I tell people I'm like Santa Claus when I do these studies. I see you when you're sleeping and I know when you're awake because I can see your EEG. This sleep fragmentation, which is very common in obstructive sleep apnea-hypopnea syndrome, results in excessive daytime sleepiness. And you've just seen what a hazard to your health that is. There are a wide variety of consequences. We call snoring spousal arousals. I've never had a patient come in because he snored. I've never had a patient come in because the bed partner was bothered by the snoring. But I have had a lot of people come in because they were being bothered by their bed partner who was being bothered by their snoring. Excessive daytime sleepiness at work is more likely to be misinterpreted as laziness, inattentiveness, or lack of motivation than it is to be, it would be an unusual supervisor who took you aside and said, you know, you're pretty sleepy, I think you ought to see your doctor. Poor school performance. Anyone who's ever had children knows that sleepy children do not look sleepy. Sleepy children look wild and crazy. And obstructive sleep apnea in children is usually misdiagnosed as ADHD, at least for a long time before the correct diagnosis is made. So it doesn't surprise me that methylphenidate works in these patients because they're actually excessively sleepy because they're having obstructive sleep apnea. And by the way, it's becoming an epidemic in children. I was just talking to my son's old pediatrician last week, and he said that it is extraordinary how overweight his patients are these days. And they're starting to run into type 2 diabetes in his practice, and he didn't used to have to treat that 30 years ago. And they treat obstructive sleep apnea-hypopnea syndrome in children by taking their tonsils out, and that will cure it about 100% of the time. But the underlying cause is not their tonsils. The underlying cause is they're overweight, but he can't get them to lose weight. Because the only way you can get children to lose weight is to have their parents take them out bicycle riding, have their parents take them playing at the beach, have their parents throw a frisbee around with them, and the parents won't go out and do that with them. Recent projections suggest that more than 800,000 drivers were involved in sleep apnea-related vehicle crashes in 2000, cost 1,400 lives and $15.8 billion in that year alone. Crashes tend to be at high speeds, like I said, and that's why they're so bad. No skid marks, asleep at the wheel. It makes it impossible to treat an asthmatic if he has obstructive sleep apnea until you treat the apnea. This is a fugitive from a medical job. You don't have to read that slide. There's a higher incidence of gastroesophageal reflux because when you're sucking and not drawing air, you suck acid out of your stomach into your esophagus. It takes much longer to clear acid when you're asleep because you cannot swallow while you're asleep. You have to have an EEG arousal and a swallow. It takes several swallows to clear the acid. You don't produce as much saliva at night. You have to treat the obstructive sleep apnea to get rid of the gastroesophageal reflux. It causes diabetes. Serum testosterone levels fall like a stone in sleep apnea. They recover within about 9 months of CPAP. And it's a pituitary problem. Your pituitary just doesn't tell your testicles to produce testosterone. Your brain shrinks. At UCLA, they compared 200 and some patients with obstructive sleep apnea with PET scans and MRIs compared to their whole database. Huge portions of the brain shrink. Huge portions of the brain are dysfunctional metabolically. People with severe obstructive sleep apnea are certainly at increased risk of cardiovascular disease independently of risk factors that are shared by the conditions. They include hypertension, stroke, coronary artery disease, and abnormal heart rhythms, especially atrial fibrillation. This is a huge number of patients. It's the Wisconsin Sleep Cohort, the 1,500 plus patients. These are the people with untreated severe obstructive sleep apnea. This is everybody else. As you can see, they're sort of clumped. This is fatal cardiovascular events. Fatal cardiovascular events are strokes and heart attacks. At the end of 12 years, 144 months, the worst of the better had a death rate of 6%. Untreated obstructive sleep apnea patients had a death rate of 16% from fatal cardiovascular events. This also includes treated severe obstructive sleep apnea patients. This is non-fatal events. It's non-fatal heart attacks, strokes, coronary artery bypass surgery, TIAs, which are transient stroke-like events, and angioplasty. The rate was 8% in the worst of the better, and it was 32% in people with untreated severe obstructive sleep apnea. This is the solution. This is nasal CPAP. This is your typical obstructive apnea-hypopnea syndrome patient. Look at that neck. Just looking at this photograph, you wonder, how in the heck does this guy breathe at night? And this is the solution.
So you have to wear one of those at night?
Or lose weight.
Or have a hole cut in your neck.
Is there an oxygen tank?
No, you don't need oxygen. You just need continuous pressure to hold your airway open. Most men with a neck more than 17 inches have obstructive sleep apnea syndrome.
So he has to wear this the rest of his life?
Or lose weight.
How about an operation?
Oh, there are surgery can be 100% effective. You have to really agree to a 3-stage operation if you want to make sure that it's...
We hope that you've enjoyed this presentation of the Floating Doctors Preventative Healthcare Series. And if you or anyone that you know seems to suffer from any of these conditions, we strongly urge you to seek your doctor's advice on how you can investigate and potentially manage this condition before it becomes serious.